So I would like to give you the update on the large bore percutaneous vascular closure devices. And here is my wish list. Some of them are absolute necessities, and some of them are what has been already achieved. But really, in summary, there is no ideal large bore vascular closure device at the present time. As you can see, I'm conflicted to a certain degree by participating in previous clinical trials and also current clinical trials on several large bore closure devices. So, as I mentioned, there is no ideal device, but what has to be really one of the most important things is that we should be able to achieve rapid and reliable hemostasis with lower complication rates that we are even achieving at the present time. So there are a variety of different devices, as you know. Here is the list of the devices that have been approved for clinical use here in the United States as far as large bore closure is concerned, and the publications. Of course, one that's most commonly used is ProGlide or ProStyle at the present time, the updated version. And the important thing is that this device was not designed for large bore closure, so you have to improvise, and frequently you have to use 2 or maybe sometimes even 3 devices. The technical success ranges between 94 to 97% with this particular device, and the Manta, which is the latest device that is approved, has a technical success of 98%. So this is the goal for any future devices. If they're going to be marketable, can we achieve that technical success rate and the complication rates of less than 4.2%? So here are some of the investigational devices that are in the clinical trials at the present time. Actually, CrossSeal has a completed clinical trial, but it's still not commercially available, and it is not exactly clear what are the issues with it, but I think it's related to the ease of use. Percusil is ongoing in the clinical trial, and it should be completed in a month or so. And this device offers very promising results with, as you can see, from the European trials, a 96% technical success rate. And here are shown basically 4 steps to use the device. And as you can see, the device has technical success of 96% and low incidence of vascular complications. It has an inside patch, as you can see here, that conforms nicely to the arterial wall and is bioabsorbable. So there are a few other ones. Not all of them are listed here. One is the Arterica large bore closure device that actually uses a fascial closure, cribriform fascia, and that device was used first in man, but it's still not undergoing clinical trial abroad or in the United States. And the Absorba-Seal is a very appealing device. It's a device that similarly like to the Percusil closes from within and sandwiches the artery also from above with a polymer that's bioabsorbable. Here is Arterica information. That's from Dr. Larsson, who's a vascular surgeon from Sweden, designing this device. And this is Absorba-Seal that has a small bore closure devices, but also 14 French and 18 French. First in man have been done for 14 and 18 French abroad, and 6 French is, the trial has been completed in the United States. So it has very few steps. Basically, it has a proprietary sheath, and then you advance the device, you snap it on the proprietary sheath, and you have this lever there. You basically pull the device back until you feel that it's close in proximity to the anterior wall. So there is a patch-like device on the inside, and you have a tactile sensation when this is appropriate, and you just pull one knob, and that's it. So this is a 14 French device in patient that's fully anticoagulated with perfect seal. So what are the unmet needs? None of those trials have included patients that have morbid obesity or extreme calcification of the anterior wall or circumferential calcification, and also patients with extensive atherosclerotic disease of the vessels or vessels that are smaller than 6 millimeters in diameter. And of course, tortuosity for some of them is a challenge as well, and less for the other ones. So in conclusion, large bore vascular closure devices technical success varies tremendously from the publications, depending on the type of device, between 83 and 98%, and as far as technical success. And the vascular complications, again, vary significantly from 2% to 14% from the previous clinical trial. So patient selection and imaging is absolutely essential to achieve good hemostasis. And in the next decade, we will definitely see dramatic increase in the use of large bore vascular closure devices due to popularity of all the endovascular procedures, EVAR, TEVAR, TAVR, and other structural heart interventions. But one very, very important issue that has been not addressed at the present time is the reimbursement. So none of those commercially available devices are reimbursable at the present time. Thank you very much for your attention.